a Leeds City Council production on vitamin D. Today we're talking about vitamin D. Around 1 in 5 people in the UK have low levels of vitamin D, especially older adults, pregnant and breastfeeding people, infants and people with darker skin. Vitamin D is essential for good health. It affects people's bones, teeth and muscles as well as mental health and immune systems. A lack of vitamin D can lead to painful bone health conditions in both children and adults.
An animated sun is shining. A peaked cap is placed on top of the sun, and a bottle of sunscreen and a parasol appear next to it.
Our bodies create vitamin D from direct sunlight, but sun protection is important to protect against skin cancer.
A calendar appears and is open at the month of September. The sheet is removed to reveal the month of October. Further sheets are removed one at a time to reveal the months of November, December, January, February and March.
In the UK, sunlight doesn't contain enough UVB radiation in autumn and winter months for our skin to make vitamin D, so we rely on getting it from our food and supplements.
The calendar appears and is open at the month of April. This sheet is removed to reveal the month of May. Further sheets are removed one at a time to reveal the months of June, July and August.
Even in the brighter summer months when the sun is stronger, some people still won't get enough direct sunlight to make vitamin D. For example, babies and children, people who are not often outdoors, or wearing clothes that cover a lot of skin. People who have darker skin, including those from an African Caribbean, or South Asian background, may also not make as much vitamin D this way. We can get small amounts of vitamin D from some plant-based foods and animal products including egg yolks, oily fish, liver, red meat, mushrooms, and some plant-based milk alternatives. Vitamin D is added to some butters and cereals to fortify them, but generally not to cow's milk, as is the case in some other countries.
A small plastic bottle appears with vitamin D supplements written on the label. The lid is removed and the bottle is tipped upside down and a small oval vitamin tablet falls out of it.
Since it is difficult to get vitamin D from sunlight and diet alone, all adults should consider taking a daily supplement during the autumn and winter months. For people who are at risk of vitamin D deficiency, supplements may be recommended all year round. In the UK, vitamin D supplements or drops for under 5s are available to buy at most pharmacies and supermarkets.
Balance scales appear with 10 micrograms on one side and a selection of different ways of stating the same amount on the other. 10 micrograms can also be written as 400 units, or the number 10 followed by the Greek symbol for the letter M followed by a G, or the number 10 followed by the letters IU, or the number 10 followed by the letters MCG.
For adults and children over 1 year, the recommended amount of vitamin D to take is 10 micrograms or 400 units per day. But do not take more than one supplement containing vitamin D. People who are unsure of how much to take should speak to a pharmacist or healthcare professional before making a purchase. People who are 10 weeks pregnant or have at least one child under 4 may be entitled to financial support to buy vitamin D supplements through the Healthy Start scheme. More information is available at www.healthystart.nhs.uk. Vitamin D helps keep people's bones, teeth and muscles healthy, as well as impacting mental health and immune systems, so make sure we are all getting enough, especially during the autumn and winter. For more information, please visit the Public Health Resource Centre at www.leeds.gov.uk/PHRC or call 0113 378 6200.